Hi guys. For today, I'm going to talk about the cuts to Medicare that were made under the current administration. So the Big Beautiful Bill Act made massive cuts to both Medicaid and Medicare. And so with the amount of money that it is projected to cut over the next 8 years is over $500 billion. So in 2026 alone, there is projected to be cut $45 billion. And it'll raise to about $75 billion a year after that. And this makes a lot of cuts to medical insurance for immigrants as well, lawful immigrants, such as refugees and those with protected status. And so people like that have even paid into this system, but they are being cut from receiving its benefits. So it also delays other assistance to the elderly. There is such a thing called Medicare savings programs, which has not gone into effect yet. It was planned, but funding for it has been cut, even though it hasn't even started yet. There's also these saving plans also cover prescriptions, and that coverage for extra prescriptions has been cut as well. This program was also aimed to help low income people. So the people who need it the most are impacted the most. It also it's very likely that the amount of healthcare providers accepting Medicare and Medicaid will reduce because the amount of money the government is going to pay them is reduced. So especially in like American corporate culture where everything is focused on maximizing profits, if you're viewing it from that standpoint, then it's not in their best interest to take those programs because they could be taking on other patients they're going to get more money from. And there's also going to be cuts to stuff like vision and dental, which were already very lacking as they were under Medicare and Medicaid. It's also at the same time, there's a ton of other stuff in the bill that are going to increase the national deficit that are not related to Medicare and Medicaid. But the bill covered a lot of subjects. So it's going to increase the national deficit by hundreds of billions of dollars. And so they're taking that debt and it's affecting Medicare and Medicaid to cut costs there to reallocate that money. So it's triggering something called the pay-as-you-go rules. So because there is already something in place that triggers automatic cuts to healthcare programs such as Medicare and Medicaid, because just as a reaction to the increased national deficit and those pre-existing standards and processes were intentionally triggered by the Big Beautiful Bill, even if they weren't established by the Big Beautiful Bill. So really this is Medicare and Medicaid is not limited to the elderly, but Medicare is, and this massively affects both programs. So the elderly, especially particularly low income individuals, and immigrants are going to be highly impacted and suffer their health and eligibility for health care and their access to health care in a massive way.